Hello friends, welcome to JDC English classes, and this video is specially for the Telangana Pharmacist students who are preparing for grade 2 pharmacist. So in this session, we will discuss some important MCQs based on the previous question papers and designed by the GDC platform. So first question is intravenous drug given at which angle? Intravenous drug given at which angle? Okay. So there are different angles for administration of drugs. There are different angles for administration of drugs, and especially there is a different angle for the administration of drugs by the parenteral route, by the injection. So the options are like 45 degree, 45 degree, 10 to 15 degree, 90 degree. So the intravenous drug given at which angle? So the answer will be the 25 degree. So 25 degree is the answer for the intravenous drug of administration. Next, so this is the diagram you can easily understand. So different routes, like for example, intradermal route of administration 10 to 15 degree angle, intravenous 45 degree, and subcutaneous 45 degree, and intramuscular 90 degree. So this is very important. Only four angles, and definitely on these angles, definitely will get a chance of MCQ. Okay, so this is simply about the explanation of this question. Next continuation, therapeutic use of therapeutic uses of beta blockers. So beta blockers are the drugs block the beta receptors. They help in the treatment of hypertension and also having other clinical applications also. Yes, used in angina pectoris, cardiac arrhythmias, glaucoma, all of them. Yes, that is a simple. Beta blockers are the drugs. They can help in the treatment of hypertension, angina pectoris, cardiac arrhythmias, as well as glaucoma. So the answer is the all of the above. The answer is the all of the above. So here, this is a trick. So there are different clinical applications. There are different clinical applications of beta blockers. So beta blockers used in hypertension, angina pectoris, cardiac arrhythmias, myocardial infarction, congestive heart failure, obstructive cardiomyopathy, pheochromocytoma, dissecting aneurysm of the aorta, and also used to control anxiety, helps in treatment of thyroid disorders, prophylaxis of migraine, alcohol withdrawal symptoms can be controlled, helps in treatment of glaucoma as well as hyperthyroidism also. So these are the list of the clinical applications of beta blockers. So this side the trick is Acme COPD and this side trick is Mahatma Gandhi. So there are many number of clinical applications are there for the beta blockers. So going for the next MCQ. So what is next MCQ? The next MCQ is which of the following are systemic aminoglycosides? Systemic aminoglycosides. So aminoglycosides are the antibiotics. Comes under the category of protein synthesis inhibitor. Comes under the category of protein synthesis inhibitors. So all aminoglycosides are active by binding to 30S ribosomal subunits of the 30S ribosomal subunits and inhibit protein synthesis in the bacterium. And the options are streptomycin, tobramycin, amikacin, all of them. So here systemic aminoglycoside which are directly taken into the blood. So there are two categories of aminoglycoside, topical as well as parenteral. Parenteral means directly taken into the blood system. So streptomycin, tobramycin, amikacin, all of them. So the answer is the actually. So the answer is all of them. Streptomycin, tobramycin, amikacin, all of these are taken by systemic route, parenteral route. And if you observe only neomycin, chromazitin are taken by the topical route of administration, and remaining all aminoglycosides are taken by the gentamicin, sizomycin, tobramycin, kanamycin, streptomycin, netilmycin, amikacin, parapomycin. and remaining all these drugs are taken by parental route into nothing but systemic. And topical only two examples, neomycin promethazine, NF, neomycin promethazine. And moving to the next MCQ, the following is a selective serotonin type 4 receptor agonist. The following is a selective serotonin type 4 receptor agonist. So there are seven types of serotonin receptors present in the body. Among the seven types of serotonin receptors, serotonin type 3 belongs to ion channel receptor and remaining serotonin 1, 2, 4, 5, 6, 7 belongs to the G protein coupled receptors. So here the following is selective serotonin type 4 receptor agonist. So buspirone is a serotonin type 1 receptor partial agonist. Sumatriptan, a drug for treatment of migraine blocks serotonin type 2 receptor. Cisapride, clozapine. Clozapine is a second generation antipsychotic, also known as atypical antipsychotic. So definitely the answer will be the cisapride. Cisapride will be the answer. Yes, the answer will be the cisapride. Let's see for the explanation for more information. So agonist, serotonin 1 receptor agonist, serotonin type 1A, buspirone, a partial agonist used as an anti-anxiety drug, helps in the treatment of anxiety. So anxiety nothing but worriness. And serotonin type 1B or 1D, sumatriptan, used in migraine. So sumatriptan is an agonist at serotonin type 1B or 1D receptors. Next, serotonin type 3 receptor agonist, 2-methyl 5-hydroxytryptamine. And serotonin type 4 receptor agonist, metoclopramide, cisapride, renzapride. And serotonin type 2A receptor antagonist, ketanserin, a antihypertensive, and also cyproheptadine. So ketanserin, cyproheptadine both are serotonin type 2A receptor antagonists. And cyproheptadine is also a drug of choice for the serotonin syndrome. The syndrome is characterized by excess levels of serotonin in the central nervous system. And next, serotonin type 2A or 2C receptor antagonist. Examples are clozapine, methasergid, methasergid used in migraine. And serotonin type 3 receptor antagonists are all cetrans like ondansetron, granisetron, choice for chemotherapy-induced vomiting. Especially serotonin type 3 receptors present in CTZ, chemoreceptor trigger zone. The triggering of this CTZ they produce nausea and vomiting. Nausea and vomiting. So that's why blocking of serotonin type 3 receptor helps in treatment of vomiting. Helps in treatment of vomiting. So going to the next MCQ. The major natural progestin is, so progestin nothing but progesterone, pregnancy maintaining hormone, one of the reproductive hormone in the females, progesterone, nothing but progestin. So our options are estradiol, estrogen, progesterone, estriol. Estradiol, estrogen, estriol are three forms of estrogen present in the body. Three forms of estrogen present in the body. So progesterone, nothing but a progestin, pregnancy maintaining hormone. Pregnancy maintaining hormone. So the answer is the option C. That is progesterone. Let's see the explanation. Okay. So progesterone is major natural progestin secretion by the ovary mainly by the corpus luteum during the second half of the menstrual cycle. Physiological effect. The functions of progesterone in the body, especially in females, development of endometrium, lining layer of uterus, development of the mammary gland during the pregnancy, after the birth for secretion of milk. Milk secretion starts when it leaves decrease with birth and thermogenic reaction may increase the temperature. So once At the end of the pregnancy, during the ninth month, there is a decrease in the production of progesterone, and after that, birth immediately there is a starting the secretion of milk for the baby. So next MCQ is choose the choose the correct bulk forming agent. So here list of the drugs helps in the treatment of constipation. They make easy elimination of fecal matter by the softening. In constipation, it is difficult to eliminate the fecal matter, especially in elders, high age people like 60, 70. If they are suffering from constipation, it is difficult because slowly the body capacity decreases by increasing the age. So the options are like doxysate, esophageal, cascara, lactulose. Okay, so let's check for the answer. Which one is the bulk forming agent? Answer is the esophageal. Esophageal naturally from the plant source. Naturally from the plant source. So let's check for the answer. So here the detailed answer is given. Bulk forming agents are like dietary fibers like bran, xylem, isabella, methyl cellulose, and stool softeners like stools convert fecal matter, doxysate, liquid paraffin, and stimulant purgatives, diphenylmethane, phenolphthalein, bisacodyl, sodium picosulfate, anthraquinones, also known as amodins, naturally from the plant source, senna, cascara, sagrada. Sagada. Serotonin type 4 receptor agonist procalopride and prostaglandin analog lubiprostone analog. Next, osmotic purgatives. So purgatives, laxatives increase the easy elimination of fecal matter by increasing the water formation to the fecal matter. In the constipation, the stool's fecal matter is very hard, but these drugs make that soft and eliminate easily from inside of the body to outside of the body through anal canal, rectum. And osmotic purgatives like magnesium sulfate, magnesium hydroxide, lactulose, as well as lactitol. Okay, the bulk forming agent is here. According to our question, answer is esophageal. Esophageal. Next, the next MCQ is theophylline naturally occurring methylated xanthine alkaloid and they cause. So theophylline, a naturally occurring methyl xanthine alkaloid, chemically is a methyl xanthine, theophylline, theobromine, caffeine, commonly called as methyl xanthines and purine alkaloids. Generally, they are a CNS stimulants, stimulate the central nervous system. So options like yes, convulsions, arrhythmias, asthma, both A and B, both A and B. So theophylline, especially drugs like theophylline, theobromine, caffeine-like drugs used for the treatment of asthma, they decrease the asthma. They does not cause asthma. But high doses of these drugs, it may produce CNS stimulation, so produce convulsion. Excess stimulation of CNS increase the firing of neurons, may produce convulsion fits. And same, this caffeine-like alkaloid on heart increase the heart rate, may produce arrhythmia, abnormal rhythm on heart, abnormal rhythm on heart. So definitely the answer will be the both. So definitely the answer will be the both A and B, convulsions and arrhythmias. Convulsions and arrhythmias. So let's check for the explanation. Theophylline is one of the naturally occurring methylated xanthine alkaloids, nothing but purine alkaloids. Theophylline causes convulsions as well as arrhythmia. Theophylline is a phosphodiesterase enzyme inhibitor, helps in the treatment of asthma. And theophylline can also be used in the COPD, asthma, apnea in premature infants. Apnea, a sudden sedation in breathing, sudden abnormality in breathing. So in newborn babies, there is a respiration difficulty, breathing difficulties. The breathing difficulties can be overcome by these xanthine alkaloids like theophylline, theobromine, caffeine, and their synthetic as well as semi-synthetic derivatives. Okay, next. Mechanism of sulfonamide antibacterial. Why? So mechanism of sulfonamides antibacterial. So inhibition of dihydrofolate reductase, inhibition of dihydrofolate synthase, inhibition of cyclooxygenase, activation of DNA garase. So DNA garase is one of the enzyme helps in the DNA synthesis. So here sulfonamides does not activate the DNA garase. And cyclooxygenase. So inhibition of cyclooxygenase is by NS-AIDase enzymes. So this is also not answer. And inhibition of dihydrofolate reductase is by the trimethoprim, pyrimethamine. And inhibition of dihydrofolate synthase by the sulfonamides. The answer is the sulfonamides. So let's see for the explanation for more clarity. Nothing but the answer is the sulfonamides are the first antibacterial compounds clinically used, and these sulfonamides inhibit the folic acid synthesis by inhibit dihydrofolate synthase enzyme in the bacterium. So let's check the explanation. So, sulfonamide being structural analogs of PABA, para-aminobenzoic acid, competitively inhibit enzyme folic acid synthetase, nothing but folic acid synthase. PABA, para-aminobenzoic acid, a key component in folic acid synthesis in bacteria. But this PABA having structural similarity to our sulfonamides, so sulfonamides enter into the folic acid synthesis and make a false folic acid, which is not useful for bacterial cell wall production, whatever it means, bacterial replication. Okay, so this is the explanation. So here para-aminobenzoic acid plus glutamate plus pyridine produce a dihydrofolic acid. But our sulfonamide inhibit dihydrofolate synthetase and compete with the para-aminobenzoic acid, decrease of folic acid synthesis in the bacterium. If folic acid synthesis decrease in the bacterium, then what will happen? There is no further replication of bacterium. Next, next MCQ. Precursor of vitamin D present in skin is precursor of vitamin D present in the skin is. So option ergosterol, tachysterol, 7-dehydrocholesterol, calciferol. So let's see the answer. The answer is 7-dehydro. Answer is 7-dehydrocholesterol is a precursor for the vitamin D. So here, let's see the explanation. So when sunlight exposed, our skin is exposed to sunlight, the 7-dehydrocholesterol converts to cholecalciferol vitamin D3, and this enter into the liver. In the liver, it converts to 25-hydroxy vitamin D3, and in the kidney, it converts to 1,25 dihydroxy vitamin D3. Maintains calcium balance in the body. So 1,25 dihydroxy vitamin D3 is present in the body. It regulates calcium balance in the body. That is the answer. Next, an emotional state unpleasant in nature associated with the uneasiness, discomfort known as. So emotional state like unpleasant associated with uneasiness, discomfort is known as anxiety, weariness, epilepsy, fits, excess convulsions, sedation, as well as depression. So sedation nothing but a sleeping behavior. So definitely the answer will be the depression. So let's see for the correct answer. Sorry for inconvenience. So it is anxiety, weariness, emotional state, unpleasant, associated with uneasiness, discomfort is known as anxiety. So let's check the explanation for more clarity. Emotional state, unpleasant in nature, associated with uneasiness, discomfort, and concern or fear about some defined or undefined future threats. Undefined future threats. The somatic symptoms. The somatic symptoms are like anorexia, loss of appetite, breathlessness, decrease in the rate of breathing, palpitation, increase in the heartbeat rate, and paresthesia, loss of sensations. And epilepsy is a chronic brain disorder. Epilepsy is a chronic brain disorder which in which group of nerve cells, neurons in the brain sometimes send the wrong signals and causes seizures fits. Sedative, a drug that subdues excitement, decreases excitement, calm down the person without inducing the sleep, but causes drowsiness, a feeling of sleep. Depression, described as a feeling of sad, unhappiness, loss of interest, self-negligence, anorexia, loss of appetite, sleep disturbances, or suicidal thoughts in case of the depression. In case of the depression. Uses of baclofen are musculoskeletal disorder, tetanus, orthopedic procedures, all of this. So baclofen. So baclofen is one of the drug related to the central nervous system. Related to the central nervous system. So the answer of this MCQ is all of them. Baclofen used for musculoskeletal disorders, tetanus, orthopedic procedures. Okay. So let's see the explanation. Musculoskeletal disorders like muscle strains, sprains, myalgia, cervical root syndromes, herniated disc syndrome as well as low back pain, lower back pain, and spastic neurological disorders like cerebral palsy, multiple sclerosis means degeneration of myelin sheath, loss of myelin sheath, poliomyelitis, and hemiplegia and quadriplegia are treated with the diazepam or baclofen. And orthopedic procedures like fractures may be done after administering the diazepam. After administering the diazepam. Next MCQ. So going for the next MCQ, which route of administration used for drug sensitivity testing? Drug sensitivity testing to understand how much the skin is sensitive. For example, if any person, if he is first time taking the antibiotics, then definitely he should go for the skin sensitivity test. So how his body reacting to antibiotic? Is there any chance of allergic reaction? For that purpose, so we will go with a very small doses on the intradermal route. So the options are like intradermal, intramuscular, intravenous, intranasal. So intradermal route is useful for the skin sensitivity test to determine how much the skin sensitive. If the skin may produce allergic reactions. So the skin sensitivity test is performed at very low doses to know the how much the skin is reacting to particular class of drug. The answer is the intradermal. The answer is the intradermal. So let's see the explanation for more clarity. So drug is given within skin layer or dermis, rising a bleb. So bleb nothing but like this, rising a bleb, swelling like. And painful effect, definitely pain will be there. Mainly for testing sensitive to drugs. Some persons may produce allergic reactions to particular drugs. So that's why initially we will use small dose. If that small dose does not producing any allergic reaction, any sensitive reaction, so definitely then we will go for the higher doses. And examples like BCG vaccine, smallpox vaccine are given by intradermal route of injection. So this is the epidermis, this is the dermis, this is the subcutaneous tissue, this is the muscle tissue. So directly into the dermis we are taking the drug into the epidermis. Okay. Next MCQ. Choose the correct direct acting sympathomimetic which used as a bronchodilator. So directly acting sympathomimetic that acts as a bronchodilator causes dilation of the bronchial smoke muscle. and helps in treatment of asthma. So salbutamol, ephedrine, cocaine, tyramine. Yes, direct acting sympathomimetic and a bronchodilator is salbutamol. So ephedrine also a bronchodilator, but it is a mixed acting drug. Okay, so in the sympathomimetics category, mixed acting drugs, indirect acting drugs, direct acting drugs. The answer is the salbutamol, one of the common drug for treatment of asthma. One of the common drug for treatment of asthma. Answer is salbutamol. So let's see the explanation for more information and clarity. So direct acting sympathomimetic, catecholamine, dopamine, adrenaline, noradrenaline, these are naturally present in the body. Non-catecholamines like clonidine, salbutamol. So yes, clonidine is alpha 2 receptor agonist, salbutamol beta 2 receptor agonist for asthma, and indirect acting drugs reuptake inhibitor, cocaine. So decrease the reuptake of neurotransmitters from post synapse to presynapse and increase the levels of neurotransmitters at synapse. And acting by displacement, amphetamine. Amphetamine increase the displacement of monoamines from the synaptic vesicles. And mixed acting drugs like ephedrine, pseudoephedrine. And the classification on the basis of therapeutic application. On the basis of therapeutic application. So pressor agents increase the pressure on blood vessels. Dopamine, noradrenaline, ephedrine, phenylephrine, methoxamine, mephentermine. So these all drugs increase the blood pressure. And next, as a cardiac stimulant, stimulate the cardiac muscle. Adrenaline, dopamine, isoprenalin. And next, based on bronchodilators, causes dilation of bronchial smoke muscle, helps in treatment of asthma. So salbutamol, terbutaline, salmeterol, formoterol, benbuterol, isoprenalin. So isoprenalin is a beta receptors agonist, that is a semi-synthetic. Next, as a nasal decongestant, phenylephrine, xylometazoline, nafazoline, pseudoephedrine, oxymetazoline. So these are the list of the drugs as a nasal decongestant. Helps in the treatment of nasal congestion, excess accumulation of mucus in the nose, nasal blood vessels. Next, as a CNS stimulants, methylphenidate, amphetamine, methamphetamine, dexamphetamine. And as an anorectics, causes loss of appetite and helps in weight reduction. Sibutramine, amphetamine, fenfluramine. Anorectics means decrease the appetite, decrease the hungerness. And as a uterine relaxant, relax the uterus, ritodrine, isoxaprine, salbutamol, terbutaline. So relaxation of uterus helps in the abortion. Next MCQ. Next MCQ is properties of aminoglycoside includes. Properties of aminoglycosides includes. So what are the properties? So aminoglycosides are nothing but an antibiotic inhibit protein synthesis in the bacteria. Aminoglycosides tetracyclines are the two protein synthesis inhibitors acts by binding to 30S ribosomal subunits. Aminoglycosides tetracyclines inhibit the protein synthesis in bacteria by binding to 30S ribosomal subunits. Okay, so examples like option active against all aerobic gram-negative bacilli, highly water soluble, misreading of mRNA codon, especially aminoglycosides inhibit protein synthesis in bacteria by causing misreading of the codon sequence. So, proper sequence of a codon anticodon will produce good proteins, but misreading of the sequence may produce false proteins. That proteins are not suitable for the bacterial replication. So, definitely the answer will be the all of the above. All of the above. So, yes, aminoglycoside act on all aerobic gram-negative bacteria and highly water-soluble polar compounds. And polar compounds are ionized molecules. Ionized molecules should be taken by parental route. Ionized molecules are having poor absorption through the oral route, and they causes misreading of the mRNA codon. So let's see the explanation. Let's see the explanation for more information. So, active against the all aerobic gram-negative bacilli. So, especially Aminoglycosides effect on aerobic bacilli only, aerobic organisms only, not on anaerobic organisms. And mechanism of action, misreading of mRNA codon and decrease of protein synthesis. Ionized completely in the solution, so not absorbed orally and unable to cross blood-brain barrier. So polar molecule, ionized molecules are having poor absorption through oral route, unable to cross blood-brain barrier as well as placental barrier. Okay. Next, adverse effects like nephrotoxicity, blocking of neuromuscular junction, ototoxicity, damage to ear, and oxygen dependent uptake. So, these drugs acts on only aerobic organisms because entry of aminoglycosides into the bacterium requires oxygen transport. And gentamicin is the prototype drug. Gentamicin, among this class of aminoglycoside, first drug is the gentamicin. So that is the explanation. Next, choose the correct adverse effect of progesterone. Pregnancy maintaining hormone progesterone adverse effect is so options: breast engorgement, rise in body temperature, esophageal reflex, and all of the above. And all of the above. So the answer is the all of the above. Breast enlargement. So enlargement of breast, rise in the body temperature, esophageal reflex. All of these are answer. So breast engorgement, rise in body temperature, edema, esophageal reflex, acne. All these are comes under adverse effect of progesterone. Irregular bleeding of amenorrhea during menstrual cycle, abnormal bleeding, long-term use of progesterone in hormone replacement therapy may increase the risk of breast cancer. Given in early pregnancy, progesterone cause muscularization of female fetus and other congenital abnormalities. So, abnormalities to the baby. Next, Ondansetron and granisetron both are. So all cetrons are selective serotonin type 3 receptor antagonist. So option serotonin type 1 receptor antagonist, serotonin type 2, serotonin type 3, serotonin type 4. So all cetrons are selective serotonin type 3 receptor antagonist helps in the treatment of vomiting. Helps in the treatment of vomiting. So the question is clear. The answer is also very clear. The answer is option C. Answer is option C. So here, list of the drugs helps in the treatment of vomiting. List of the drugs help in the treatment of vomiting. So anticholinergics like hyoscine dicyclamine, H1 receptor blocker like diphenhydramine, dimenhydramine, promethazine, doxylamine, meclizine, cyclism synergism, and neuroleptics, nothing but antipsychotics, blocks dopamine type 2 receptors, chlorpromazine, triflupromazine, chlorpromazine, and the prokinetics increase the movement of GIT, metoclopramide, domperidone, etc. And serotonin type 3 receptor antagonist all cetrons, ondansetron, granisetron, palinosetron, ramosetron, and neurokinase 1 receptor antagonist, neurokinase 1 receptor antagonist or substance P antagonist, aprepitant, fast aprepitant, and adjuvant supportive agents like dexamethasone, benzodiazepine, dronabinol, a cannabinoid derivative. So these are the list of the drugs helps in the treatment of vomiting, helps in the treatment of vomiting. So next MCQ. Bambuterol is a prodrug of which drug? So terbutaline, indomethacin, salbutamol, cyclosinate. So cyclosinate a glucocorticoid. So leave the not answer. Indomethacin is an NSAID. And here terbutaline, salbutamol are the two drugs. Helps in the treatment of asthma by causing bronchodilation. By causing bronchodilation. So the answer is simply the answer is a terbutaline. So terbutaline, bambuterol, bambuterol, bambuterol is a prodrug of terbutaline. Bambuterol, terbutaline. So here the explanation. sympathomimetics, beta receptor agonist, especially all drugs like salbutamol, terbinafine, albuterol, all these drugs are beta 2 receptor agonist and helps in the treatment of asthma. So here, adrenergic drugs causes bronchodilation through beta receptor stimulation, increase the cyclic adenosine monophosphate formation in the bronchial smooth muscle and causes relaxation of bronchial muscle. Treatment of bronchial asthma, beta receptor agonist, alpha receptor antagonist. And bambuterol is a prodrug of terbinafine. Terbinafine is a beta 2 receptor selective vasodilator. So, terbinafine dilate the blood vessels under the influence of beta 2 receptors. Indomethacin and codeine phosphate can precipitate in bronchial asthma. Salbutamol is a beta 2 receptor agonist. So, indomethacin, codeine phosphate can precipitate asthma, can produce asthma. And salbutamol is also a selective beta 2 receptor agonist, helps in the treatment of asthma. Helps in the treatment of asthma. Next MCQ. The primary pathway of metabolism of the sulfonamoids is the primary pathway of metabolism of sulfonamoids. So sulfonamides are the antibacterial compounds. So metabolized by the which of the following process? Acetylation, methylation, conjugation, sulfonation. Sulfonamides are metabolized by the N-acetylation. So sulfonamides undergoes phase 2 metabolism, acetylation, specifically known as N-acetylation with help of N-acetyl transferase enzyme. Okay, so the answer is the acetylation is the answer. So here, sulfonamides are metabolized by the N-acetylation and N1 by the non-microsomal enzymes. Their acetylated metabolites is inactive, having low aqueous solubility, especially at acidic pH, and that may lead to it may cause crystalluria. Crystalluria. This crystalluria minimized by the soluble drug sulf-isoxazole. So the sulfonamides may form like a crystals at pH change and may accumulate in the urinary tract. Crystalluria, formation of crystals in the urinary tract. That crystals may cause pain to the urinary tract. So the crystalluria can be decreased by the sulf-isoxazole. Sulf-isoxazole, a soluble sulfonamide. Soluble sulfonamide. And not only to minimize the to increase the water intake and also taking the alkylating agents. So taking of alkylating agents and intake of water may decrease the crystalluria formation. May decrease the crystalluria formation. So next MCQ. Beta blocker that can be used in anxiety disorder. That can be used in anxiety disorder. Option etinolol, metoprolol, propranolol, diltiazem. So anxiety, what is anxiety? A worriness, a tension, worriness about simple things, worriness about what is happening in the past, worriness about what is going to be happening in the future. So the worriness, if the worriness become excess, that may develop anxiety disorder. In the anxiety, our sympathetic activity increases, our respiration become irregular, and change in our CNS actions also. So the drug sympatholytic used in treatment of anxiety is propranolol. The answer is the propranolol. Because in the anxiety there is a sympathetic activity is higher. To decrease that excess sympathetic activity, propranolol will be helpful in the treatment of anxiety. The treatment of anxiety. So here the list of the drugs in the treatment of anxiety: benzodiazepine, diazepam, chlorodiazepam oxide, alprazolam, oxazepam, lorazepam. Azapirons, buspirone, gepirone, ipsapirone, beta blockers, propranolol, sedative antihistaminic, block the histamine receptor with sedation property, hydroxygen. So these are the list of the drugs which can be helps in the treatment of anxiety. Anxiety nothing but worriness. So anxiety leads to increased sympathetic activity, increased sympathetic activity. So next MCQ is the Formation of vitamin D active metabolite 1, 25 dihydroxycholesterol, sorry, dihydroxycholecalciferol takes place in. Formation of vitamin D active metabolite 1, 25 dihydroxycholecalciferol occurs in. So the options are like liver, kidney, intestine, as well as bone. The answer is the kidney. So the activation is takes place in the kidney. So answer is kidney. Answer is the kidney. The same previous question is also we uploaded in the previous slide in this session itself. So let's see the explanation. So cholecalciferol vitamin D3 converted to 25 dihydroxyvitamin D3 calciferol in the liver, which is in turn converted to 1, 25 dihydroxycholecalciferol calcitriol in the kidneys. Calcitriol in the kidneys. So here, when exposed to sunlight, the skin exposed to sunlight, 7-dehydrocholesterol converts to vitamin D3, that is cholecalciferol. That vitamin D3 converts to 25 hydroxy D3 calciferol, 1, 25 dihydroxy D3 calcitriol. And calcitriol helps in the cell growth and differentiation, division of cells, calcium and phosphate metabolism in the body. Regulate the calcium as well as phosphate in the body. Regulate the calcium as well as phosphate in the body. So this is we discussed the 20 MCQs, with a detailed explanation. So like this interesting videos, subscribe to the GDC English classes. Okay, definitely you will enjoy the content and you will learn the content, and definitely the GDC classes as well as GDC YouTube channel will help you to reach your goal, nothing but to crack your goal. Okay, thank you.